Today we're talking about threads. Okay, so threads are the latest idea around rejuvenation and anti-aging, and it's complementary as far as, in my opinion, with respect to fillers or biostimulants, and what you can do with threads is quite amazing, because like patients used to go for facelift straight away, but today you can delay the onset of wanting to have a facelift simply by using threads. The threads by nature, the latest threads dissolve, and as they dissolve they biostimulate, and what I mean by that is that you get good collagen and elastin formation that follows as the thread dissolves. There's essentially two types of threads that are out in the market today in the world. Polydioxone or PDO, and many people just coin the phrase PDO threads because that's the most common thread that's available. And following that, there's the PLA thread or the PCL thread, which is polylactic acid thread, and that thread lasts a lot longer. However, its tensile strength or its ability to pull on the tissues may not be as dramatic as the PDO threads. So PDO threads are more common because they can pull. Now, threads in general can be used either as a stimulant just under the skin, and those are usually called mono threads. And mono threads have no barbs in them at all. They're very fine. They've got very, very small diameter. They are almost smaller than a human hair. When they go in, you don't need full anesthesia to put them in, and they stimulate collagen formation and thickening of the tissues and brightening up of the skin. So that's your mono threads, and they do tighten up the skin as well, but they will not perform, they will not do a lifting effect. So if you're looking for lifting, and part of the aging process is sagging of the facial tissues, and you want to look at counteracting that, you have got to use lifting threads, and these threads are called cogged threads. So cogged threads, simply think of a fishing hook having small barbs, and how it holds onto the piece of bait. Those small barbs are the cogs. They are orientated in a fashion around the actual thread itself, and of course that gives them different types of configurations, and we configure them according to whether it's a dimensional, three-dimensional, like a 3D cog, or a 4D cog, or a 5D, 6D cog, and so on. That really describes the orientation of these cogs. Clearly, the more cogs you've got and the more cogs that are configured around the circle or the diameter of the thread itself allows to push on different aspects of the tissues to give you greater lift. Also, you get cogged threads that are what we call divergent or convergent threads. Most of the time we're using convergent threads, which creates a thread with an anchoring on the one side and a pull on the other side, kind of like an anchor of a boat, where a boat is the pulling of the tissue, where the tissue would represent the boat, and the anchor would be where you would anchor the thread in a non-mobile part of the face, which might be within the hairline, or where there's a lot of fibrous tissue behind the ear, or above the zygomatic arch, and so on. So there are places where you can actually strategically use as anchor points for pulling threads. Now, typically the PDO thread would last for 4 months and dissolve, but you get a lasting effect that can be up to a year, where you've got collagen and tightness of the tissues. But once the thread is dissolved, and after about a year, your tissues will return back to their normal state. With respect to the PLA thread, you're looking at about 1.5 years for full dissolving of that thread, and your effects can last sometimes up to 5 years, depending on how many threads you put in and the configuration of the thread lift that you are doing. So with respect to threads, PLA threads, whenever you can have them done, they are the thread of choice. However, there's always a downside, and one of the downsides, of course, and one of the complications is infection. and it's more difficult probably to manage an infection with a PLA thread as opposed to a PDO thread, which is going to dissolve faster, and the resolution of a complication is much faster with a PDO thread versus a PLA thread. So we've got these aspects to consider, but overall the outcome from a PDO and a PLA thread looks very much the same, except maybe the duration of the PLA thread is longer than the PDO thread. So that's it. So we've got some different configurations that we can look at, whether we are looking at doing a cheek lift, a brow lift, or an eyelid lift, or a jaw lift and a neck tightening procedure, or a sharpening of the jaw. It depends on the patient's age and sex and their sort of overall health status. For instance, we don't really want to be doing threads on patients who have autoimmune disease or connective tissue disorders. That would be a contraindication, or somebody with a low immune system would be a contraindication. And obviously I get asked questions regarding COVID and the vaccine. With respect to COVID and the vaccine, the immune system is hyperstimulated, so you don't want to really be getting threads too close to having a booster shot. You'd want to wait a good 6 weeks. So that's really it. The threads, it's minimally invasive. You make small little punctures under local anesthesia with a needle, and that allows you to place the cannula. The threads are sometimes preloaded within a blunt cannula. A blunt cannula meaning that the tip of the cannula is blunt, so it pushes the tissues away. In particular, it pushes away the blood vessels. So if the cannula is placed at the right depth when you're placing the threads, you do not get bruising. You will get swelling and some temporal asymmetry when the threads go in, so sometimes the one side of the face may be a little swollen compared to the other side, but that resolves usually within 24 hours. We like to ice our patients a lot after the procedure for a faster recovery. And of course, I always like to say to my patients that 50% of the work has been done by placing these threads. I often say, look, it's like putting rebar into soft concrete. It takes up to 7 days for that concrete to cure in order for the rebar to work itself to make a nice strong building. Same thing with respect to threads. You want the threads to actually become mature and cured within the tissues. So for the first 10 days, you don't want your patient to be rubbing their face, sleeping on a low pillow, having massage, being in hot saunas and so on, or exercising vigorously. That just simply wouldn't work. So for the first month, you want to be relatively quiet with your face. You don't want to have dental procedures where you have to have your mouth stretched open, especially if you have the threads around the jawline and around the mouth area. So, how the patient looks after themselves after the procedure in the first month will determine the outcome of the threads as well. Sometimes we have to put an extra thread in here and there during the course of the journey, of the thread journey, and that can occur when one of the threads sometimes pops loose, which can occur, especially if there was a really vigorous facial movement, which sometimes you can't help. If you get angry or you get excited or emotional. So these are things to consider. With respect to infection, we like to give patients prophylactic antibiotics just because you're placing a foreign body, and it's good to have that coverage, especially if you are using threads that are going through a patient's hairline. That's an area where there's lots of bacteria. We clearly don't want patients to be washing their hair or using hair dye within the first couple of days of the threads. It takes at least 24 to 48 hours for the small little puncture sites to close up. So clearly no makeup on the face for the first 24 hours. There we go.